Wednesday to Sunday, Crossroads Plaza on Weston Road in North York, 10 a.m. to 6 p.m. Jill.
Thanks, Khalil. Nick Sturkovich is keeping track of your weather. How's it looking this afternoon, Nick?
Well, unfortunately, Jill, we're sitting under cloud cover in literally the city of Toronto and just the areas close to the lakeshore. So, I mean, if you look just outside of the city of Toronto, you've got temperatures around 8 to 10 degrees, but if you kind of took a line from the 401, 407, and then down to the lake, we're getting moisture that's sort of coming off of the lake there with the easterly breeze, and that's kept us under cloud cover. So with that being said, 2 degrees is basically what we've hit through the day today. More or less where we're going to hover for tonight. Fog patch is redeveloping again. I think we'll be about 3 degrees through the overnight. And then tomorrow, though, a bit of a shift in the winds, and that's going to help to dissipate fog by about noon. And into the afternoon, mainly sunny skies and a high of 17. So well worth the wait, I would say. But warm weather on the way. You'll just have to wait until tomorrow.
Okay. Thanks, Nick. And Jasmine Sepidas, what's happening in the CBC Toronto newsroom this hour?
Jill, with a deadline for a walkout on Friday, the union representing Ontario college faculty and the College Employer Council are back at the bargaining table. The union tweeted it invited college management back to the table and have also agreed to meet again tomorrow. Both sides are trying to reach a negotiated settlement prior to the strike deadline. And York Regional Police have made an arrest in 2 violent sexual assault cold cases. A Toronto man is facing multiple charges, including kidnapping, sexual assault with a weapon, and uttering threats to cause death. The violent assaults date back to 2013 and 2014 in Richmond Hill and Mississauga. Jill.
Thanks, Jasmine. CBC News has learned that starting April 1st, travelers returning to Canada will no longer need to take a pre-arrival COVID test. The announcement is expected to come from the federal government tomorrow. It's the latest change for travel. The government recently changed the re-entry requirement from PCR to a rapid antigen test. There are some rules that remain. There still will be random testing on arrival, and vaccine mandates are in place. My next guest has been advocating for change to travel regulations. Dr. Zain Chagla is an infectious disease expert in Hamilton and an associate professor at McMaster University. Dr. Chagla, good afternoon to you. I know you've been pushing for the federal government, calling for this change for some time. Why do you think it has happened now?
Yeah, I don't know why it didn't happen 2 months ago, to be fair. I mean, I think the data was there that Omicron was here, and testing at the border was really kind of silly when we couldn't even test people locally. And so the government moved forward as rapid tests, I think, as a way of just to dip their toe into the water to say that this testing, could drop without leading to any type of major issue, and finally are accepting that this type of testing really isn't adding much other than inconveniencing the traveler. So, I mean, I'm happy to hear it, but at the end of the day, it came a couple months too late, considering that we got past our Omicron wave a bit earlier, and there wasn't any data to suggest keeping this testing around really added much.
Do you think it has anything to do with the current number of cases?
Again, yeah, if we can't test cases locally, then why are we worrying about the border, right? There is so much more we could use those resources in testing and worrying about that and recognizing again, fully vaccinated travelers who are asymptomatic coming over the border are probably not the problem we're dealing with locally, and really putting all these resources towards it, really discouraging people to travel when, again, they could acquire COVID-19 down the street or at their local restaurant or local stadium. It really didn't make a lot of sense to align, and perhaps that was the reason why they finally decided to let it go.
Yeah, so, and I understand. I hear your argument against it. There will be, people who hear this news and feel perhaps fearful and maybe not clear as to why it's not necessary anymore. And especially, I would add, given that we are hearing, we've talked about this earlier today on the program, growing wave of case numbers going up in many parts of Europe, a spike in, South Korea and lots of locations. So isn't it better to have some way of discerning that a traveler coming into this country does or does not carry COVID?
Yes and no. I mean, I think if we had unlimited testing and could do everything appropriately, then sure. But these are resources at play here, and recognize that, the traveler that comes into Canada asymptomatic, passes their negative rapid test, and then becomes symptomatic 2 days later in Toronto, actually can't access a test locally, right? And you would be worried about that person more than the person that's asymptomatic coming over the border. And again, the value of a rapid test done in a fully vaccinated, asymptomatic traveler at a given time, sometimes done over a Zoom call, which some of the agencies are doing, the sensitivity of that type of testing, the odds of you finding someone with acute active COVID is probably a needle in a haystack at that point. And again, is that really where we want to put our efforts? Is that the money we want to throw at travelers? Or do we tell people to make their risk behaviors the same? Again, I can go tonight to the Scotiabank Centre and watch the Raptors without getting a rapid test in a crowd full of 20,000 people that are barely wearing their masks properly. And so again, that's probably the venue I'm more worried about if it spreads COVID-19 around, not necessarily, again, an airplane with vaccinated travelers who are wearing masks that are asymptomatic coming onto a plane.
Mm-hmm. Okay, so then what do you I mean, as I mentioned, the federal government is going to continue to randomly test travelers to identify, perhaps track variants. Is there value in that?
Yeah, I mean, I think surveillance for variants coming into Canada is important. It's not to say that they're not going to come into Canada. All these variants are going to come to Canada as they come into countries with even the strictest travel restrictions that are dealing with their Omicron waves. Every country has dealt with an Omicron wave, essentially. But I think there are ways to make it a whole lot more efficient. It's, number one, incredibly expensive still what we're doing at the border. There were quotes from the Globe and Mail of it being $1.23 billion to date in terms of offering this testing. But you could certainly, improve networks, make public-private partnerships with universities and other researchers to actually do some of this testing at the airport. You can allow people to do it anonymously without necessarily, picking them and registering them and pushing them for testing. And I think, again, that money could also be reinvested in the local communities to make sure that, people that are getting COVID locally also have access to sequencing to see what variants are circulating amongst people in Canada, which is very under-resourced at this moment. And so, again, yes, it's a part of the strategy, but it's not the only part of the strategy. And again, it probably does need to be folded down to a little bit of random and anonymous surveillance as compared to, again, large numbers of people getting random testing at the airport, which is costing the taxpayer money, without, again, those people being able to be tested the moment that they get COVID in Canada.
Now, you mentioned a couple of times, Dr. Chagla, in your sort of rationale for why this doesn't make sense is all these people coming off a plane who have had to show proof of vaccination and were wearing their masks on the plane and so on. There are some medical experts, Dr. Suman Chakrabarti among them, who have said that it's time for the vaccine requirements to be scrapped as well. That is a travel restriction that remains in place at the moment. Where do you stand on that?
Yeah, I mean, I think there can be a need for a conversation here. And Suman, my colleague, who's a very good friend, I think has a reasonable point. Look, we know that the ability of people with 2 doses of vaccine, for example, to have protection against infection is not there after 26. Yes, they're protecting against severe disease, and that's important. But if we're using vaccines on planes as a tool to say we're going to, limit spread, then it may not be as effective as we think. And again, that aligns with much of the rest of society where proof of vaccine has been lost for gyms, bars, stadiums, restaurants, etc. And again, as long as we keep controls like masking on planes, up there, I think that's probably more of an effective strategy than proof of vaccination. And, it doesn't say that vaccine is not an important part of travel. I do travel medicine. It's an important part. We go through every vaccine for people to make sure they're protected, that they don't get sick while abroad, and they don't face the consequence of needing medical care while abroad. But again, mandating it to get on a plane to go from Toronto to Ottawa probably doesn't make a lot of sense when, again, I could go into a 20,000 person stadium in Toronto without a proof of vaccine as part of it. So hopefully with the next round of things, and I think they evaluate everything every month, that this could likely be taken off the table. But it is, certainly aligning with many of the provinces that are scrapping their proof of vaccination going forward.
And yet there's a lot of travelers. I bet many of them are at destinations they flew to this March break at this very moment because they felt comfortable knowing that the people sitting around them were vaccinated. Could removing that requirement do more harm than good?
You know, again, we go with the science here. Look, there are children traveling on planes that many of them are not vaccinated, that are exempt from the need for testing or vaccination. So there are people there. And again, you know, we have a society where 9 out of 10 people on that plane are vaccinated as adults based on the numbers that we have already in terms of what's been adult vaccinated in Canada. So it's not like you're all of a sudden having a plane full of unvaccinated individuals. But, you know, again, we have to also look at the science here that 2 doses of vaccine, you know, and people that are 26 weeks out from getting their vaccine series essentially has 0% protection against infection. And so that unvaccinated person or that vaccinated person with 2 doses may have the same ability to transmit, acquire, or have COVID-19 at any given time. So again, you know, that really does say that maybe these were the decisions that were made in local communities around proof of vaccine. You know, I think we're putting it up as a strategy to make it look safer to travel, but again, it may not be, and I think we have to respect that. Many countries have dropped the proof of vaccine as part of their entry, and so, you know, I think we have to follow our global partners as part of that.
It's really good to get your thoughts on this today, Dr. Chagla. Thanks as always.
No problem. All the best.
You too. Dr. Zane Chagla is an infectious disease expert in Hamilton, an associate professor at McMaster University. CBC News has learned that tomorrow the federal government will announce that starting on the 1st of April, travelers will not need a pre-arrival COVID test to re-enter Canada. Toronto musician Skye Wallace has a show coming up at the Horseshoe Tavern. She'll be there at the end of the month on the 31st of March, part of the 75th birthday show series, celebrating one of Toronto's oldest music venues. Here is Skye Wallace and her latest single, Truth Be Told. Behind their homes, their belongings, and in some cases, their pets. Animal shelters on Poland's border with Ukraine have been offering space and veterinary services to families who cannot bring their pets with them. Markham veterinarian Dr. Cliff Redford and his daughter Emily are traveling to Poland to help with that work. Dr. Redford, good afternoon to you. Tell me what kind of work you're going to be doing at these animal rescues and refugee camps.
Hi, thanks for having me.
I'm not 100% sure because although we've done a lot of traveling abroad in underserviced areas, we've never gone to a country that's neighboring another country that's at war. But what I do know is they need veterinarians. The veterinarians in Poland are inundated with cases of trauma and dehydration and just homeless animals. So I suspect I'm just going to be helping out wherever I can, and it might be involving surgeries, it might be involving simple logistics, or even, heck, I'll pick up a spoon and feed some soup to the refugees, whatever we can do to help.
What do you understand from the vets who are there already about the level of need and the kind of scale of the work that you'll be doing?
Yeah, the need is extreme. I mean, obviously 3 weeks ago, no one would have thought there'd be 2 million people crossing the border into Poland, and they grab everything that's important to them, including their pets. And a lot of these refugees, understandably, refuse to go on to the next, safe haven unless their animals are cared for. Some of these animals don't have their medicine, or again, are dehydrated and wounded. Some of them have been wounded in the bomb blasts and the shelling. And then there are those people who recognize that they can't take their animals any further. And so for the sake of their pets, they at least feel a lot better that they're giving it up to a veterinarian team and a shelter that's going to care for them until, as one lady said, I'm going to come back and get my goat when the war is over. Yeah.
And wait, so what is the plan? I mean, for caring for these animals, as you say, some people clearly intend to come back and be reunited with their pets at some point. Perhaps people say that hopefully at this point, but I mean, what is the plan to care for these animals?
Yeah, so the rescue centers, the refugee centers, have they do have some space for caring for these animals and keeping them, various kennels and dog runs and whatnot. But they quickly reached out to the various animal rescue organizations throughout the country of Poland, and much like the capability and hardiness of the Ukraine people, the Polish people stepped up and have tripled, quadrupled the numbers of animals they've been able to take these various rescues. So I don't think they know what the future holds for these animals, and we've even talked, my team and some rescues here in Toronto have reached out to me saying, if you end up needing to bring 40 or 50 animals back with you, we can handle the logistics here and we can house them here and find them homes. So I don't think anyone really knows what's going to happen. All they know is they got to take care of these animals right now and let these people go on to a safer life, knowing that their animals are cared for, and then they'll kind of deal with problems as they come along, as they've been doing the last 3 weeks.
This whole thing's making me want to cry.
Yeah.
Just imagining. I wonder, how are you feeling about going into, you don't know a lot about what you're heading into in terms of the details. How are you feeling?
Yeah, you're gonna make me cry just talking about it. This was a quick decision. I started seeing these images and hearing of these stories in the news, and then reading various veterinarian stories in our sort of social media pages that all vets in North America have, and I just quickly decided, I think it was Sunday night, that by Monday morning I had talked to some rescues and booked a flight and sort of figured things out in the last couple of days. And it's overwhelming, and it was a little stressful, and there are a few sort of harder to sleep nights. But I talked to my family and talked to my parents, and everyone kind of said they're proud of me and just go ahead and do what you can. So it's, I'm not so naive that I think it's going to be easy. It's going to be hard, and it's going to be harder than anything I've ever done. And, my daughter and I are going to be seeing things that we're not prepared for and dealing with complications and challenges that we're not prepared for. But the people we're going to be working with are heroes and so inspiring. So we're kind of looking forward to it in an unusual situation, and we just want to help out.
I'm glad you'll have each other, you and your daughter. Your daughter's a veterinary technician, is that right?
She's training to be, yeah. She started traveling with me after she worked at my clinic in high school, and then the last 3 years she's been around the world with me in different places. and she's become my sort of right-hand girl. You know, she's I can treat the animals a lot better and do surgery knowing that she's there monitoring the anesthetic patients, and heck, she can wrap a bird with a broken wing, wrap up their wing better than I can any day of the week. So she always makes me proud, and yeah, we're gonna pardon me, we're gonna lean on each other quite a bit, I'm sure, during this trip.
It's really extraordinary that you're packing up to do this. Dr. Redford, all the best to you. Take good care.
I appreciate it. Thank you.
Dr. Cliff Redford is a veterinarian in Markham who's leaving for Poland on Monday.